My name is Alex Love, and I am discussing my family planning campaign for program planning. The goal and purpose the goal is to reduce the number of unplanned pregnancies in school aged women in Los Angeles, California. My purpose is the purpose of the family planning campaign is to provide resources and education for school aged women in Los Angeles, California, so women are educated on contraception, sexual education, and family planning and are better prepared for motherhood. So this is my rationale. So unplanned pregnancy is a problem globally. In the United States, 49% of pregnancies are unintended. In Los Angeles itself, 48% or 393,000 pregnancies are unintended. So that's about 1 in 2, 50%. So these are the consequences for unplanned pregnancy. Unplanned pregnancy can cause social, cultural, and economic aspects of life. There's a big prevalence of abortion with it. There's medical complications that could arise with unplanned pregnancy. That could be hemorrhage, uterine perforation, cervical injury, and infection. And there's also psychological issues that can occur with unplanned pregnancy. So unplanned pregnancy in adolescents. Adolescents are less likely to complete school. There's a large maternal death rate. The death rate's larger for adolescents than adults. There's medical problems, poor weight gain, hypertension, anemia, and STIs. And there are great risks for the unborn child. This also affects healthcare costs. So nationally, 51% of all U.S. births in 2010 were paid for by public insurance through Medicaid, Children's Health Insurance Programs, and Indian Health Service. In 2010, the federal and state governments together spent an average of $336 on unintended pregnancies for every woman aged 15 to 44 in the country. So this is about Los Angeles itself. So Los Angeles is 468.6 square miles. There's about 8,484.3 people per square mile. The total population is 9,818,605,000, and broken up into male and females, there's 4,839,654 males and 4,978,951 females. The median age for males is 33, and the median age for females is 35. The ethnicity, there's 50% white residents, 47% Hispanic or Latino, 13% Asian, 8% African American, 4% two or more races, and 21% claim they were some other race. So now I'm going to talk about the family planning campaign itself. So the family planning campaign is offered to all middle school and high school women. It will cover all the facts, abstinence, contraception, and sexual education. It will cover everything already not covered in the health class. So in California, it's not mandated for public schools to teach about sexual education, which could be a reason why the unplanned pregnancy rate is so high. So here are my objectives. So my process objectives, by March 2018, coordinators of the family planning campaign will have met with school districts officials to understand what is being taught in school systems regarding sexual health. By the program implementation date, coordinators of the family planning campaign will have a curriculum of education on abstinence, contraception, and sexual health. The students' parents will also be made aware of the campaign. So it's important that the parents know what is being taught to their children, but it's also important that we don't teach just about abstinence because that's not realistic for middle school and high school age women. For individual behavior, by February 2019, increase the number of women who have access to contraceptives and are knowledgeable on abstinence, sexual health, and contraceptives by 50%. By 2019, ensure at least 75% of women in the school districts have some form of contraception or know where to find contraception. By 2019, the number of women reporting they are sexually active will decrease by 50%. For my social factors, within 6 months of the program, the family planning campaign will hold 15 screenings for sexually transmitted infections and hand out contraception. By December 2020, the family planning campaign will extend to 5 communities outside of Los Angeles. Within the first year of the program, the family planning campaign will host 3 informational sessions for families and community members of the school district. For all services, I wanted to provide 5 or more health facilities near school districts that provide direct services for contraception and information on abstinence and sexual health. For policy, by 2020, representatives will be aware of the need to mandate sex education be taught in 50% of school districts. My goal statement was by 2020, unplanned pregnancy rates in teen mothers in California will go from 1 in 2 births to 1 in 4. My needs assessment, I used a community forum, which was a place for the community to express their concerns. Then I used a nominal group process, which was a group of people who come together and rank answers, which is the consensus. So a facilitator will ask them questions, they'll answer what they believe, and then they'll come up with a consensus on what the best answer would be for the question. And then key informant interviews. So interview school officials, school board leaders, and administration to understand what's being taught in school districts now. So my design and interventions. For individual behavior, I'm going to give lectures, hand out contraceptives, make bulletin boards, use social media, and create support groups. So I'm going to give lectures on sexual health, and then hand out contraceptives, make bulletin boards with information on it, and create support groups. For social factors, I'm going to do STI screenings, provide seminars, and outreach to schools outside of Los Angeles. For health services, I'm going to team up with Planned Parenthood, and with policy, I'm going to meet with California state representatives. So with health services, meet up with Planned Parenthood, and with policy, I'm going to meet with the representatives to mandate that it be taught in school districts. My evaluation plan, how I'm going to know these things have worked out. For my process one, I'm going to collect notes, lesson plans, and collect and review them, and then send out handouts to parents, kind of seeing how they felt about it. For individual, I'm going to collect surveys to gauge how many students learned and interview students on where to find contraception. For social, I'm going to collect screening forms and records and provide telephone surveys. For health, I'm going to conduct a walking survey to see how many health services are around the school district. For policy, I'm going to look at California state laws to see if sexual education has been mandated. And for my goal statement, I'm going to use California Public Research records to see how many teen mothers gave birth in California in 2020. So here's my budget. My grand total is down there, $185,025.59. And I think this campaign will work because education is key to informing students on sexual health. The younger students learn the information through the family planning campaign, the sooner the student will be able to make choices regarding her family planning and her sexuality. Here are my references. Thank you.